Hello, everyone. Thanks for tuning in to a very special bonus episode of the Doc Lounge podcast. I'm sure you can all guess what we're going to talk about today. Drum roll, please. COVID-19. So the respiratory disease caused by the new coronavirus continues to spread around the world and in the United States. Many countries are asking people to stay at home and self-quarantine, which I'm sure you're all aware of by now. The World Health Organization has officially called the disease a pandemic. The United States has declared the pandemic a national emergency, and states throughout the country are taking major measures to try their best to slow the spread of the disease. So with this big pandemic happening, everybody's talking. There's a million different outlets to get information from social media, our news, bloggers, journalists, our next door neighbor. Everyone's got information for you. So we wanted to offer our listeners an opportunity to learn more about this virus straight from the horse's mouth, an actual infectious disease physician. So on this bonus episode, John and I got to talk to Dr. Ian Frani, an infectious disease doctor out of Arkansas. And he shared with us his knowledge on COVID-19 and really gives us a fact or fiction perspective on what's going on with the coronavirus. So we're really excited to share this episode with you. So John, Dr. Frani, and I are in 3 different locations right now. So we're podcasting remotely and social distancing. So please forgive any audio quality, ups and downs throughout this episode. Obviously, we did our best to do this remotely and as clear as possible. That being said, let's get started. Well, first of all, Dr. Frani, thank you so much for giving us some of your time today. I know for all you ID doctors and medical professionals in general, this is a very busy time.
No problem.
So, Dr. Frani, to get started, in your own words, can you give us an explanation of what COVID-19 actually is?
Sure. COVID-19 is basically a designation. It's short for coronavirus 2019. So, to know what COVID-19 is, you have to know what coronavirus is, which is basically, they are a group or a viruses called envelope viruses because they have this envelope coating on them. They are coated in some oil and some bilayers, and these bilayers actually stick out like a crown, and that's why you have the name corona. It's Latin for crown. So they some people may not know what coronavirus is or may not be familiar with what it is, but if I mention SARS or if I mention MERS, then suddenly people would remember. Oh yeah, 2003 there's SARS. 2012, there's SARS in Saudi Arabia. So those both are coronaviruses. They may not be in this category as the COVID-19, but they belong in the same family. So those basically are a group of viruses. Currently in the U.S., we have 4 endemic coronaviruses, meaning we have coronaviruses that's already in circulation that is going along the season, and the COVID-19 is basically the one that appeared late December 2019, at the end of 2019, as you know, in Wuhan, which is a city in China.
Yeah.
Dr. Frani, you mentioned there was a few things that you really wanted to clarify for the benefit of our listeners. Share with us what you're thinking.
Sure. One of the things that you have to clarify is corona. It's a virus. There is a name on it. It's coronavirus. So basically, it's not something that is new. It's new in terms of the type, but coronavirus has been an important human and animal pathogen even before. So everybody's aware of it. It's just that in the recent December 2019, this novel coronavirus or novel or new coronavirus was identified, and it's something that is different in terms of strain from the other known coronaviruses.
Interesting. And I learned that this strain started in China. Is that information correct?
Yeah, so it's different it's difficult to say originate or not, but it was first documented there in Wuhan along December 2019. Basically, one of the doctors identified a patient who visited the mark, a patient who developed some type of pneumonia that is not responding to the common antibiotics, that is negative for other testing, and they identified that as the first reported case of coronavirus. Investigation is still going on regarding exactly where it originated, how it spread out. But basically, to answer your question, yes, it's the first case was first documented in China.
Mm-hmm.
There's some speculation that it occurred in a wet market there.
Yes, that is correct. So it says that it started from some people who visited a seafood market in China, but some of the first reported cases actually have no link to the seafood market. So we're not sure if it's just happenstance that the first few was documented to be in that market, but some of the other people who were diagnosed had no link with the seafood market. But it's fairly interesting to get that tidbit of information as well.
Gotcha.
Right. I'm curious. There's some speculation that this thing has been here on our shores for quite a while, but maybe gone undetected. Do you subscribe to that theory?
Well, that's where I clarified myself early on with, when you asked me, does it originate in China? Because we don't know yet. We know that the first cases were documented there, but most likely it is it originated from China. But in terms of, are you for sure it originated there? We cannot be for sure, because you are correct. Some people are asymptomatic, but it doesn't mean you're not shedding. Meaning you can be walking around and shedding the virus without you actually having symptoms. And those could be the initial cases or the patient zero on these patients with corona, and nobody would know. But because the cluster of cases was first identified there, the number of people in terms of hospital admissions, in terms of diagnosis, were first detected in China. I think it's proved that it's not a bad not conclusion, but it's not a bad thought to think that this thing originated from China.
Right.
Dr. Frani, when you watch the news right now, do you feel like they're giving accurate information to the public?
Well, it depends on what media you are listening to. The problem here is we're in a day and age where information can be ingested from anywhere. You go to the internet, you go to Twitter, you go to any website out there, and they all talk about this coronavirus. Some are reputable, of course, and like CDC, IDSA, WHO websites, government websites, of course, are legitimate websites of medical journals, are a very good resource for actual published data about coronaviruses. But on the far side of it, and I don't want to generalize everything, but you also have celebrities, politicians, non-medical personnel who basically provide their opinion on what corona is. And unfortunately, as sad as it seems, or as sad it may be, the population would rather listen, most of the time would listen to them than the actual medical doctors, because they think that either the medical doctors are conspiracy theorists, or hiding something, or doing something like that. And so they listen to people who probably heard something that was discussed by someone, and then that's why you have this spread of information, false information. So it depends on which information, but yeah, I guess a lot of the information you get is from television. So I would be very selective on which one you actually listen to and which one you actually take in as fact.
Yeah.
That's terrific advice, not just specific to this topic, but to any number of topics day to day, and how people choose to stay informed. Tell us, how is the situation where you are?
So in the situation where I am, where we do have cases in the state that is documented positive, but we are still at the phase where the hospital is not quite getting overwhelmed yet. The hospital has been preparing for it. We have policies in place, and we have constant communication with the State Department. And you know the best way to address this is to make sure that everybody in the hospital are on the same page on what the hospital policy is. And so from at least from my standpoint, it's not yet as bad as it is in New York or Las Vegas or other countries where there's like a bunch of cases like Italy that's growing.
Mm-hmm.
Just for our listeners' benefit, just to be certain about this, you're currently in Massachusetts, is that right?
No, I'm now in Arkansas. So
okay, that's right.
Yeah, I actually moved from Massachusetts last year to Arkansas, which I think provided me a lot of benefit because right now the main goal is to kind of do social distancing in terms of gathering, in terms of walking around, and there's a lot of things in common in Los Angeles, Las Vegas, New York, and Massachusetts, and all of them have very high population in terms of square inch of people, right?
Exactly.
So it's very difficult to practice social distancing, especially in Massachusetts, where the moment you leave your apartment, there's two lines of people walking around, and the main mode of transportation is a subway.
Mm-hmm.
So I think it helped to my benefit that there's a lot of free space. There's a lot of wide areas where even if you walk into Walmart, there's more than 6 feet from the next person you're gonna walk to.
Yeah.
Well, I bet you're feeling pretty good about being in Arkansas.
Mm-hmm.
It is, but it is, but you cannot be complacent because at this point in time, travel history is no longer the main risk. It's not the end-all, be-all criteria for being positive for corona. We already surpassed that time where if you don't have travel history, you don't need to be screened for corona. I think we were past that time already. I think now we should be thinking of person-to-person contact within the city or within the state. And as you know, people keep walking around, keeps traveling. So it's nice that it's good to be optimistic and it's good to be prepared, but you should never be complacent in terms of how you prepare and what you have to expect.
What is your personal regimen for, I guess, sanitizing, for lack of a better term here? Just as an example, and put this in context, I returned from the grocery store yesterday to resupply just some basic things, some fresh produce,
Sure.
and the grocery store was well stocked. There were not a lot of people there, but I felt like it was necessary for me to go through this decontamination process before I brought a lot of these things that have been handled by multiple people into my home. What are you doing to prevent that sort of community spread?
Well, the key there is to know how the virus is transmitted. And the main form of transmission is person to person, mainly by contact. It's also transmitted to droplet, but a lot of the main transmission is through contact. And that's why the trust of the healthcare community is hand wash, meaning if you went somewhere and you tried to handle things that other people are handling, or you try to take care of patients, you always do hand washing, proper hand washing. That means you don't just put your hands into the faucet, like let the water run for 5 seconds and then stop, or get some small amount of soap, 5 seconds and stop. The recommended is at least minimum of 20 seconds of hand washing. And if you look at the websites of WHO, CDC, there's actually a proper way of doing the hand washing, so you can maximize, and eliminate all of the possible contamination, the nooks and crannies in your hand. So my personal thing is, number one is, if you touch something or if you encounter something, always err on the safe side. If you can hand wash with soap and water, then that is my regimen. So if let's say I go to 7-Eleven, I buy something, I go home, then I do my hand washing first before I do anything else, and that's about it. Unless I actually come from the hospital, which is different. If I come from the hospital, I go home, I hand wash, and then I take a bath, and then that's about it. So that, for me, I think is sufficient, because you have to understand that a lot of people you see are wearing masks, walking around, and and it's a lot of people have been hoarding masks as well. And the problem with doing the mask is, number one, the moment you rearrange, refix, or refocus the common mask, the garden variety mask, the protection is already gone, because the seal is the one that you want to contain. So once you fixed it or rearranged it, or a lot of people like pulling it down to their chin while they're not talking to someone, and then putting it back up, that already is useless. Plus, the regular mask is not something that will last 24 hours. Even the N95 mask, which is the mask that is recommended for healthcare professionals who are in contact with someone who are positive for coronavirus, only lasts, at least in published studies, is around 8 hours. So the cost efficiency of wearing a mask is not as good as practicing social distancing and hand washing. But in terms of healthcare professionals, because they're in close contact with these people, personal protective equipment, mask, gown, face shield, is definitely a thing that they must use.
I've been hearing two contradicting pieces of information. One, that when you're infected with a virus, it's dormant for 14 days before you have symptoms. And then the other one, it is 72 hours before you have symptoms.
Okay. So when you say dormant, so dormant is probably not the best word. The 14 days is the known or possible incubation period. Incubation period is basically the time from where you got the virus until the time you manifest symptoms. So it's not really dormant, it's doing something, it's just taking it 14 days to do something.
Gotcha.
But it doesn't mean that everything is 14 days. You can get it within 72 hours, you can get it within 4 days, within 5 days. But the maximum, as far as people, as far as anecdotal cases have shown, is up to 14 days. So it's the same with, for example, HIV. HIV has a very long incubation period, meaning you can get the virus, but you actually have the HIV manifestation even years after you get it. So it doesn't mean that it's dormant, just lying there not doing anything. It's doing something, but it's taking it a long time to do something.
Yeah.
So,
Okay.
so the incubation period maximum is around 14 days. So that information is correct. But it doesn't mean that the symptoms always manifest after 14 days. It can manifest even earlier. And I want to say that it's possible or most likely 14 days, because at this point in time, we don't really have that much information regarding what actually the incubation period is. And this is based on cases that is reported, that is published, and that is discussed among the medical community.
Mm-hmm.
So I've been hearing that the virus is really dangerous for seniors to get. What about toddlers and babies? I have a lot of little munchkins in my life right now. And with their little immune systems, I was wondering if that's kind of the same thing as seniors.
So, in the immunosuppressed, the elderly is always, and multiple comorbidities are always have the highest risk for developing multiple symptoms. And that is, because their immunity is not as good, and of course they have comorbidities as well. But it doesn't mean that because you're a child or you're a baby, you're probably not going to get it. You may also get it, but you're more likely be the vulnerable population the higher the ages. If you look at all of the population that's been infected and died from coronavirus, most of them are above 80 years old or around 80 years old. Most of them have multiple comorbidities, significantly congestive heart failure, diabetes, hypertension. Most of them are female. So a lot of the people that gets affected are actually older people than the younger ones.
Mm-hmm. Okay.
So with respect to that, Dr. Frani, the term underlying condition has been used a lot. I'm curious, what exactly would you describe as an underlying condition? Somebody who is it presents with that comorbidity, for instance, and just maybe a little bit of clarity on that for us, please.
So that's an excellent question, because it's not really what pre-existing condition means. If you look at the websites of CDC and WHO, they describe diabetes, heart disease, asthma, pre-existing lung injury as pre-existing conditions. So I think in general, patients who have uncontrolled or unchecked diseases are definitely at higher risk. Like, you may have hypertension, but you're taking medication, your blood pressure has been normal. You're most likely less at risk than patients who actually have hypertension and are taking medications, or in terms of heart asthma or uncontrolled diabetes. If your diabetes is under control, even if your diabetes, your risk is still likely a little bit higher than those who doesn't have it, but your risk is lower compared to those who have uncontrolled diabetes. So it's very difficult to pinpoint, but chronic comorbid illness is usually what they talk about. And when I say chronic comorbid illness, these are illnesses that people usually need to take care of for a longer time, that can be stabilized. Like heart disease, you can have heart disease and you've been taking medications for a long time. Diabetes is a chronic medical illness. Asthma is a chronic medical illness. Emphysema is a chronic medical illness. Now, if you have a fractured arm, that probably does not count as a pre-existing comorbid condition. If you have like a bout of diarrhea, that's probably not a coexisting medical condition. But I think what they focused on is those who have chronic medical illness, because a lot of studies show that even if you have these chronic illnesses, you're always in a state of increased sympathetic response. So your body is a little bit jacked up in terms of compared to normal people, and then your immune system may not be working appropriately. But in terms of chronic, or in terms of pre-existing condition, I think they're referring more to chronic medical issues.
Okay, that makes sense to me. Does that explain perhaps the reason that many people appear to be asymptomatic is because they are otherwise healthy? Or is there some other explanation for that?
Sure. So viruses in general, in terms of causing respiratory disease, is not as profoundly symptomatic compared to bacteria. But it does not mean that they cannot cause respiratory failure in patients. Yes, comorbid illness, being healthy, being young, most likely you will develop either very mild or asymptomatic symptoms. But it doesn't mean that healthy young people will not have, if they got infected with corona, will not be one of the serious cases. There are documented cases already of healthy young people who've been diagnosed with corona and have been on a ventilator, and they are perfectly, healthy. But you have to understand that this is not so different compared to influenza.
Mm-hmm.
If you look at the influenza cases, it's not a black and white as well. There are people who are perfectly healthy, young, who develop influenza and suddenly develop into respiratory failure for no reason, even though they live a healthy life. But the majority are asymptomatic and have mild symptoms. So definitely a healthy protoplasm, as we call it, or a healthy body, definitely plays a role in terms of how you present the symptom. But it's not a guarantee that you will not present with severe symptoms. But it's not specific to corona. Respiratory syncytial virus, influenza, can also present the same thing. It's just not reported or as widely known in the public compared to what is happening now.
Gotcha.
So I have a friend with an autoimmune disease, and she has been on chloroquine for, I think that's how you say it, for many years. And she recently went to the pharmacy to get it filled. and they were all out. And she learned that there is a connection with this medication and the coronavirus. Can you explain that?
Yeah. So first of all, just I just want to lay it out there. There are currently no approved medication for coronavirus. The current advice or recommendation is supportive treatment, meaning if they need a ventilator, you provide them with a ventilator. If they need medication to help with their heart or their lung, you give them medication for heart or their lung. If they have secondary bacterial infection, you give them antibiotics. But the virus itself, there's no proven treatment yet. Now, chloroquine, or recent studies have shown the other variant, hydroxychloroquine, showed in vitro have activity against SARS-CoV-2 or COVID-19. It's not approved yet as an actual treatment for it because, like I mentioned, there is no approved treatment. But I've seen people who are hoarding chloroquine and hydroxychloroquine with the hope that, if they got corona, this will decrease the symptoms. We don't know that. There's no, all of the evidence are in vitro. In vitro means from a dish. It's not tested in humans or in vivo. And the problem with in vitro is in vitro doesn't always equal to in vivo, or testing by petri dish does not equal to what would happen if a human does it. And the problem is there's no randomized controlled trial or good trial to support that this actually helps. And the other issue is if you started taking this chloroquine, hydroxychloroquine, how do you know that it is the one that's helping you and you're not just riding out the natural course of the virus?
Mm-hmm.
So it's very difficult, but there are anecdotal evidence, there are studies, and there are in vitro studies, meaning laboratory studies, that chloroquine, especially hydroxychloroquine, does have an effect on coronavirus. Is it something that I would recommend for people to take? No. I would recommend to have an infectious disease physician to consult on the case, and it's a multidisciplinary decision if this is something that needs to be tried or not. But the current recommendation is still supportive. And there's other investigational agents aside from that. The hydroxychloroquine and azithro, I don't know if you guys heard about it, has some significant impact on the SARS corona. The problem is the side effect is going to be horrible.
Mm.
And there's news of a person who took chloroquine but is not really the medicated version, actually had issues. And that's the problem, is you don't take medication without consulting your physician, and you don't take it as a prophylaxis. So from my standpoint, is it something that I would give to a patient? It depends on the discussion with me, my pulmonologist, and the family, if it's something that needs to be tried. There are other investigational agents that is also in the pipeline who have been shown to have effect on the coronavirus, but all of them are not approved yet because and all of them are lacking good evidence. When I say good evidence, randomized controlled trial that is tested on people. So these are all in vitro studies.
So
Gotcha.
I've got to ask you something else here that's a little bit off topic, but not too far in terms of treatment. Has this virus been transmitted through the air? Is it airborne? Is it transmissible in that regard, or do we have any evidence one way or the other on that as of yet?
Mm-hmm. So the difference between airborne and droplet is how long it stays in the air and the distance it can go to. So droplets are usually a bigger size of droplets that usually extends up to 6 feet. Meaning if I cough something, it goes up to 6 feet. So if you stand 20 feet from me and I cough, you're probably not going to get it. Airborne means it's in the air. If you're standing behind me, you're probably going to get it, and it's suspended longer in the air and can travel distances. Now, coronavirus, like any other virus, is a droplet. It's transmitted through droplet, and the droplet goes to the surface or to the skin or to devices called like fomites, which is a vector for transmission. And through that droplet, when you touch it, and you can get it, and that's how it transmits. Droplet and then contact. Now, the precaution initially has been airborne, and the reason for that is we don't know a lot about aerosolization of the coronavirus. As far as we can tell, droplet precaution, its transmission is droplet, and the current recommendation right now is actually you don't put patients on airborne precaution unless you have aerosol generating procedure, like you're intubating someone or you're suctioning patients, because that increases aerosolization in the air. So the short answer, most likely it's not airborne. Most likely it's not going to transmit through long distances. It is definitely something that is droplet transmitted, contact transmitted. Some study would show that it can survive or it can remain in the air for about 3 hours. And certain changes in humidity and temperature can also change the viability of the virus.
Dr. Frani, you're clearly well informed, and we really appreciate all of that. I've got a big policy question for you. I don't believe that any of this is really preventable. In other words, global pandemics. But what could we have done as a society or as a country to have been better prepared for something like this, in your opinion?
So, in my opinion, even before this hit the fan, WHO has already been warning, the government that this is something that you need to watch out for. This is something that you need to be careful or prepare for. And we just have to accept what happened. We didn't prepare that much. We underestimated the capability of the virus, and that is because, I guess, from the history of SARS and MERS that also happened in Asia, it didn't cause that much impact in the U.S. So that significant confidence, I think, made us complacent into thinking that this is not something that is going to cause a lot of problems with us. It's just going to stay in Asia. And WHO already know about it even before everything goes down. But, we as a society, our government did not really prepare as much as we should have. The other thing that we could have controlled is the amount of information that is getting distributed. Because we acted late, there's a bunch of information that came out and people started to panic. The tissue paper debacle is a big issue because you cannot buy tissue paper anymore. It's out. All of the stores are out. And because a lot of people think that it's gonna be an apocalyptic type of picture where you just hoard everything. But it's a virus. It's basically like influenza, but literally congested into a small time frame. Influenza and RSV kills a lot of people over years in 1 year, but people doesn't panic about it because we know that it exists, and we know that if you have the flu, it's going to go away, so you just go home. But now, if you have cough and everything, you go to the hospital, and then, the hospital is not prepared. We don't have a lot of masks. We don't have a lot of kits to test. And I think that's one of the lessons that we need to take from this scenario is, we need to be able to prepare. We need to have a policy, government policy in terms of what to do in terms of this outbreak. And the other thing is a lot of our materials are not really made in the U.S. Our masks are not really made here. So if one of the countries who has a significant effect on corona suddenly slow down, our supply slow down. So I think those type of prepare, and I don't want to make any political statement about it, but what I'm trying to say is, if we know that is our way of getting those resources, we should have planned ahead and discussed that this is what we need to do. I think we just underestimated how far-reaching, the spread of the coronavirus is. In terms of what else we can do, I'm not really sure. There's a lot of information that is lacking, but that's what I think is the main thing that we need to take out from this scenario.
Yeah.
I have just a couple more questions for you. First one, I want to give you an opportunity to shout out to somebody with thanks or acknowledgement or anything like that. Is there anybody that you'd like to acknowledge during these particularly challenging times that deserves extra credit or recognition?
Well, the main people that you have to definitely praise at this point are the medical frontliners. You know,
couldn't agree more.
We practice social distancing, and that's what the CDC recommends, and that's what WHO recommends. And a lot of people stay home, and that provides them protection. But you know, you have frontliners who actually come to the hospital knowing that the risk is going to be high, and knowing that they're going to be exposed to people who sometimes lie about their travel history, which they do. And there's always this high risk, and you're basically gambling. Am I going to be the asymptomatic case? Am I going to be the mild case? Or am I going to be in the respirator tomorrow? But yes, despite that, and despite the fact that you know that your hospital is lacking equipment, or there's not much testing kits available, despite that, you still go. And you just have to praise, you know, our doctors, our nurses, our volunteers who actually step up and do these things. You know, I'm, like I mentioned, I'm not originally from the U.S. I'm originally from the Philippines, and a lot of the doctors there are going to front lines despite having handmade mask and gowns that is just basically for due to lack of resources they have to do. And especially here, you know, our ER, our surgeons, our doctors, our nurses who despite this very scary scenario still goes to the hospital. So, and you know, you cannot I don't think you cannot put anything else above what they are doing. You know, a lot of people are thinking that no, the ID physicians are doing a lot. We are, but you have to understand that before we see the patient, there are a bunch of people that they see before me. And those are the people that actually is the front lines. You know, when I see the patient, I already know I have to be worried. But when they see the patient, they don't know. They don't know if that patient is something that they need to worry about. And the sad thing about it is a lot of the issues are, instead of helping our healthcare workers, a lot of the issues are turning into something that is political, turning into something that is going against the medical professionals. You know, I've heard that people doesn't agree with the distancing because they feel like we're just saying that so that we don't have to see patients. It's not. It's for your own benefit. It's not from our benefit. You know, we don't want you to get sick. And you know, just those people that really work hard day and night is something that needs to be praised. That needs to be looked up to.
Yeah, my husband and big brother are both firefighter paramedics, and I really admire their strength during this time because not only are they going into uncontrolled environments of a house and subjecting themselves to sick people, but they're also around their families and just an unknown. So, you know, I totally agree with you that all these first responders really do deserve a shout out.
This is a scary, frightening time. It's unprecedented. And social distancing, and there's a lot of implications here that could last for years. What gives you hope right now, whether it be the development of experimental medications and treatments and vaccinations, social distancing, government's response, but what gives Dr. Frani hope right now?
So the number one thing that, you know, gives me hope that this is going to be handled effectively is, number one, is how the medical community is addressing the situation. And I have to specify that the medical community, how it is addressing the situation. The government as a whole and the stock market, a whole different mess. But the medical community addresses the situation, I think, very effectively, and how they manage to address resources and deviate resources is something that you wouldn't think would happen because of a lot of stuff that is going on in terms of trying to prevent, trying to figure out what this virus is. The other thing is, I believe that certain events will show the worst of humanity, which is it is showing the worst of us. I mean, hoarding. People have been using tests that they shouldn't be using. People who go to spring break despite clearly being told not to go to. But it also shows the best in us, and that is something that kind of gives me hope that it will be better. And I think one of the biggest thing is we had this before. This is not a new scenario. We had SARS before and we had MERS before. We have data from history on exactly what can we look up to and what can happen. And just based on the history, based on what we know about the virus, based on what we know, about our strategy, and what is happening to China and what's happening to Korea, as you know, and I don't know how good the information is China is bringing out, but their new cases is becoming lower, almost zero on some days. Korea also has the same thing, and now Italy is going up to the curve, and that is the big thing. Is as you flatten the curve, and you've been hearing this statement multiple times now. It's basically you try to limit going to the hospital and try to just stay home, and then try to limit using hospital resources. Once you flatten the curve of patients being diagnosed and being diagnosed with cases, sooner or later, this is going to be just a regular virus. This is going to be an endemic coronavirus, and that's what I believe. I think this is going to be endemic. I think the purpose of trying to prevent it from you being infected is not a goal anymore because of how it spreads. So I think that is what some things that kind of give me hope is because we know what most likely is the course of the virus. We're hoping that it's going to be seasonal. Doesn't mean that it is. Meaning as the heat and the humidity kind of goes up, we're hoping that it kind of decreases the cases. But again, this is the first time we're encountering this type of coronavirus, so we're not sure if that is going to happen. But hopefully, all of those, because of what we know from history, what we know from the other coronavirus, and what the medical community has instituted in response to those history, I think gives me hope that this is something that we can eventually get past through. Doesn't mean it's going to happen tomorrow or next week or next month, but eventually.
Dr. Frani, I know this might be a hard question, but in your professional opinion, how long do you think it's going to take for us as a nation to get past this and, to the point where we're not asked to be social distancing?
So that is a very difficult question to ask. The reason why is I think at this point in time, we don't know yet exactly how the virus acts in different scenarios. Like I mentioned, it show in terms of temperature, cool, hot, humidity, temperature wise, research have shown that climate comes into play in terms of stability of the virus outside the human body when it gets expelled. The greater the time the virus remains stable in the environment, the greater the capacity for it to infect other people. And now that the heat, the temperature is going to go up and the humidity is going to go up, we're hoping that based on the seasonal characteristics of other viruses, that it will follow the same pattern. And if that happens, then it might be within a year. But like I mentioned, this is going to be something that is new. I'm not comfortable, trying to figure out how long it will take because this is a fairly new scenario that we're dealing with.
That's understandable. So to conclude this episode, I've got one last question for you. For all our listeners tuning in today, can you give us some good hygiene tips to keep us safe? And then also, what are the symptoms that we should be looking out for that are more of a red flag for coronavirus?
Mm-hmm. So the best way to protect yourself is to avoid social gatherings. The social distancing thing. It doesn't mean that you stay at home and lock yourself and starve yourself to death. You can go and buy stuff. You can go, but you have to understand a 6 feet rule, meaning you as much as you can, you distance yourself from the next person of at least a margin of 6 feet, and that coincides with the droplet. Number two, and probably the best recommendation is hand wash, proper hand washing. There is no there is no other measure in medicine that can prevent infection more than hand washing. Not, not putting a mask on, not putting a gown on. It's hand washing, and you have to hand wash at least 20 seconds. And what I like to do is I sing happy birthday in my head 3 times, and then wash my hands, my wrist, my nails, and make sure that every time I eat food or I touch my face, I wash my hands. And so meaning if you go to the store and you pick some stuff and you buy some stuff, don't touch your face. Just consciously prevent yourself from touching your face. Go home, wash your hands, and then you can touch your face, how much you want. But hand wash is the best way to prevent it. If you have a minor illness, like for example, you have a scratch or a small wound or something that does not need emergency medical attention, do not go to the hospital. Do not go to the emergency room, because you're basically overwhelming the healthcare personnel, and you're also increasing your risk of getting the virus. So if you have, let's say you have a small wound in your arm or in your leg that doesn't look infected, that's very small and you're stable, don't go to the hospital and ask for antibiotics. And if you have symptoms meaning cough, fever, colds, shortness of breath, one of the things that most hospitals are implementing is giving them a call, giving ER a call, and asking them, is this something that I need to go to there to be tested on, or can I just stay at home? Because most hospitals have a policy of calling in first, meaning they call you first and they ask and they decide if you can go home and be quarantined or just stay in the hospital. So, and the other thing I want to emphasize is stop hoarding stuff. It's not helping. Stop hoarding a mask. It's not going to help you. Stop hoarding tissue paper. It's not going to help you. If you get, the packages, you can get packages. It's not the virus can live up to surfaces in about 3 days. So if you're getting packages from somewhere else, it will take a few more days to get it. But don't hoard materials that our healthcare workers can use, like N95 mask, regular mask, gloves. Are my advice to our doctors or soon-to-be doctors who are listening. Stop prescribing hydroxychloroquine to yourselves. It's not going to help. At this point, we don't know the efficacy of it. And the other thing, I think the most important thing is, as much as you can, a lot of our hospitals are needing resources. Some hospitals are able to accept donations, so if you can donate, that would be great. Because the main goal is to flatten the curve, meaning the main goal is to make sure we don't have a lot of cases, a lot of people coming to the hospital being tested if they don't need to be tested. And just, I guess, be nice to each other. It's not something that you should be trying to fight over. I just recently see people fighting over toilet paper in Walmart. So it's not an apocalypse. It's a virus that we know. It's good to be prepared, but you have to know which one to follow. And the last thing is, always, it's good to know, look for information, but always verify. So don't listen, if let's say a celebrity tweeted this, doesn't mean that it's correct, but doesn't mean that it's wrong either. Once you see it, then you verify on your own, meaning go to actual websites that have actual information like IDSA, CDC, WHO. It's always nice to get information. I'm not saying people do not to get information. Get information as much as you can, but you have to verify. I've heard about the garlic stuff. I heard about, cracking up your air conditioner to very high levels. I heard about people buying mosquito repellents because they said that the virus is now vector-borne. So all of those are not correct. So the garlic, I'm not sure if that is from a bat. Is it because of the vampire thing? That's not gonna help you. It's gonna make you smell.
Yeah.
The mosquito, no, it's not transmitted by mosquito. It's not a vector. So mosquitoes can transmit dengue and malaria, but not corona. It's a virus. Antibiotics are useless, right?
Yeah.
And cracking up your air conditioner does not do anything. So it's you have to be at very, very, very cold temperature for you able to even slow down the effect of the virus, or very, very hot temperature to kill it. So basically, that's about it. If you have any questions, I would suggest to go to websites of IDSA, which is the Infectious Disease Society of America. Go to CDC, which is the Center of Disease Control website, and the WHO, World Health Organization. I would refrain from looking at, although I'm not saying they're wrong, I'm refraining from looking at Forbes.com, Huffington Post, Rappler, or whatever website that doesn't have actual references to support it, and base what you know on actual facts and not on hearsay.
Well, Dr. Frani, I cannot thank you enough for giving us some of your precious time today. All the information you shared with us was truly so valuable, and we really appreciate it.
Yeah, no problem. And thank you for giving me the opportunity to kind of shed a light on this. Well, thank you so much. Have a good day, guys.
All right. You too. Bye.
Thank you so much for tuning in to today's bonus episode of the Doc Lounge podcast. On behalf of Pacific Companies, I am sending you all much love. Remember to stay safe, healthy, and positive. We're all going to get through this together. Have a great day, and until next time.